Ordinarily, when you marry or you are sexually exposed, unprotected for 1 year, we expect a pregnancy to come out. But now it's not like that. Something has happened. There's a shift. A woman is considered to be infertile, or a couple is considered to be infertile after 1 year of regular, unprotected sexual exposure. When we say that regular, unprotected, what does this mean? It means this woman is having sexual relationship 3 to 4 times in a week. And that translates to 12 to 16 times in a year. That translates to in a month. And that translates to 196 sexual exposures in a year. Before you will say this couple have a problem. But change in the system, now we have people, husband is living in Abuja and wife is living in Lagos. And they meet only during what the woman considers as her ovulation period. From common biology, you would think that a woman who menstruates every 28 days should ovulate the 14th day of her cycle. It doesn't work that way.
Basically, the normal proportion of normal sperms to abnormal sperms are lower in men that take antihypertensives and antidiabetics, because most times when you look through the microscope and you look at the sperms, they have abnormal looks. You have some with double heads, double tails. Some of them you don't find their acrosomes. The DNA is much more fragmented when you're dealing with men that are on such medications. So, but the part of it that is most interesting is male infertility over the years. When you do a lifestyle modification, it shows, because the men are lucky, unlike the women where you have the number of eggs you produce in a lifetime given to you at birth or during your pre-developmental stages. For the men, you produce sperm every 90 days. So if you make a swap or you have a turnaround or modify your character or your lifestyle, it shows automatically when you're, if you give yourself a number of months and you have new sperm cells being generated. So you find out that the coast is clear. So for men, it's always easier to deal with if you've not had a permanent damage. But if it has to do with medications, sometimes you can't really do anything about it, because you can't take him off his antihypertensives, you can't take him off his diabetic medications as well. So you have to work with what you have. So that's what makes male infertility very difficult to treat.
Welcome back. This is Insights. We're talking fertility and childbearing, and our guests Dr. John Idahosa and Adesua Evans. Great to have you on Insights.
Thank you.
We're so delighted to have you on Insights.
Thank you.
We're going to give you an opportunity to ask your questions. Are you ready with your questions? Okay.
Thank you very much, sir. That was so informative, and I've learned a lot of things today. You spoke about smoking and alcohol. I was actually waiting to hear sugar. So I wanted to know if sugar affects a man or a lady's infertility.
Sugar? Okay, how sugar affects?
Yeah, increase in sugar levels, diabetes. Diabetes affects men. Diabetes does reduce the sperm count. And this way you see them more.
There's a certain level of sugar is one of the, in the form of fructose, is one of the energy source which the sperms need to move. Now, there's a certain level that is acceptable in the testes, in the whole arrangement. Once you have an elevated sugar level, you give it excess. So most times when you bring out the sperms, most of them are dead because you create a, you know, in secondary school you're taught osmosis. So you create an extreme environment for them to thrive, and that's not what they are used to. So once you increase the sugar level, you notice that the sperms just die because they can't actually cope in that environment. So I think for the men, it's immediate. Once a man is diabetic and the sugar level is uncontrolled, once you bring out the sperms, because we test for sugar as well once we're giving their semen, and you notice that once the sugar is elevated, naturally you expect all the sperms to die.
Okay. And we can also, it also affects an elevated blood sugar in a man affects the vessels. The vessels become thinner. The blood supply to the testes reduces. And you know, any organ that suffers a reduction in blood vessel also affects its operation, its functioning. All right, that's why you see men will not have you've heard of diabetic foot. Yes, there are some organs that elevated blood sugar does affect. The foot, the eyes, the testes, because of this special arrangement those vessels, those organs have.
My question is on the vagina. Can using water alone, is it enough to wash your vagina, or using some drops of Dettol, to your water to wash it? Does it have any effect, the Dettol itself, on the vagina?
Or any kind of antiseptic?
Antiseptic, not only antiseptic soaps, Dettol, or that likes. Yeah.
Okay. I'm aware that people, apart from just antiseptics, people even add lime to wash the vagina. And I used to ask, what do they want to achieve? The vagina contains microorganisms, and there's a balance. God made it that way. No vagina is sterile. God did not intend it to be sterile. That's why when a woman takes some very potent antibiotics, one of the things she will experience is vaginal itching, because when you take away all those bacteria, you leave the fungal organisms and some viruses to thrive. It's like you go to the bush. When you remove all the rats and rabbits, and what do you expect? Then I don't know. You change the ecosystem. What should a woman use to wash the vagina? Just salt and warm water and salt. That's all. Don't put Dettol in your vagina. Don't put Izal. Don't put Savlon. All those beautiful things they sell to make the vagina scent, they just change. The problem is that they change the milieu, the pH, and they kill sperms. Invariably, they just kill sperms. What lubricant does is when the woman's Bartholin's gland, which is one tiny gland inside the vagina that is supposed to lubricate the vagina during sex, when that gland is not functioning well, maybe during infection, or the woman is not properly psyched, you can't come from home, carry your dusty, dirty body, and you want to go and bounce on a woman when she's not psychologically ready, she is going to shut off her brain. And one of the ways you know that her brain is shut up is that the vagina is dry, because the Bartholin's gland did not get the stimulus from the brain. Now, so lubricants, like I would recommend Vaseline, just simple, pure petroleum jelly Vaseline. If you must go medical, use the KY jelly. KY jelly is just a bland, very bland jelly that does not change the pH of the environment. I urge our women, please, please, don't use substances that change the pH of the vaginal environment. They lead to infertility, they lead to scarring. When they come to deliver, you will know that this vagina is not stretching. It's not pliable. So the baby's head is captured in the head. Your episiotomy is bigger. The invalid come back to us to do surgery. They would do a lot of surgeries to widen the vagina that has been narrowed. You know, women do a lot of things. They think that, oh, if the man is complaining that the vagina is too wide, and the woman now knows that, okay, if I do something, if I use something caustic, it will narrow it. It gives the man the pleasure that he's a strong man. But the woman is going to come back to us one day, because the woman is going to suffer a lot of vaginal bruising, which translates to infection. The infection goes into the cervix and changes that antigen antibody, goes to the uterus, creates an endometritis, goes to the fallopian tube, block the fallopian tube. The woman is in a worse state. Leave the vagina with just warm water. And so you may say that, what about after menses? Does the woman, see, even if you do not wash the vagina after menses, the vagina will wash itself. Naturally. The vagina will wash itself, because it's an epithelium. The vagina is a plastic. That thing that you see as, see, this is the vagina. It's about 10 centimeters long. Now, you see how thick it is. You see it as just a tube. We see it containing a wall. This wall is 30 layers thick. God made a provision that every 24 hours, this commission is, these epithelial cells, they are shedding. New ones are coming from under. So whether you wash your vagina or you don't, God is going to do that for you.
Thank you so much, sir.
Okay, thank you so much, sir. I actually have two questions.
Okay.
The first one is, you talked about protein intake affecting the men.
Yes.
Does it affect the women also?
No.
Sorry, what's that?
Pyritin, the use of pyritin.
Oh, okay.
Yeah, the use of
Chlorpheniramine
protein.
maleate.
Yes.
No. We do not have scientific evidence to prove that it affects the women, but it does affect the men.
Okay.
Chronic use of pyritin.
Okay. Okay, then secondly, is it 100% accurate that, because earlier on we were talking about the female, the chances of infertility. You also spoke about if there's a fibroid. So is it 100% accurate that if there's a fibroid in the womb, there's no chance for fertility?
Okay.
For conceiving?
Okay. It's good you ask this question, particularly because of where we're also doing this program. Fibroid is a very, very common phenomenon in the Nigerian women, in the African women. If I do a transvaginal scans on all the women here now, 60% of you will have fibroids. It's an African thing. So when we are listing the causes of infertility, and we're going to put them in order, maybe I have about 100, I will list fibroid as maybe number 89. Tells you it's low down the ladder. But fibroids located wrongly, very wrongly, it has nothing to do with the size, it has to do with the location, can cause infertility. I mean, let's look at this again. This is a uterus with fibroids. This is a fibroid. This means nothing to fertility. This means nothing. But this smaller one means something. This is where the baby is supposed to stay. And there's a fibroid there. This woman is going to find it difficult to get pregnant, but not impossible. It's been difficult. This is a tiny fibroid here. Well, sperms are very smart. They're going to navigate their way. But during delivery, this woman will not be able to have a vaginal birth. Now, if a fibroid is located somewhere here, it's going to block the tubes. So, I want to recommend to our women, please, as much as possible, don't do fibroid surgery unless we have enough scientific evidence that the fibroid is responsible for the infertility. Because fibroid surgery is not as easy as people think. Apart from the mortalities you hear of, they create scars in the uterus, fallopian tubes are blocked, the uteruses become weak. I prefer to have a woman with 50 fibroid tissues that will not prevent a pregnancy. I prefer to have her get pregnant with those fibroids. I have a stronger uterus than the woman who has had a fibroid surgery. Now, let me round up my discussion on fibroids this way. Fibroid and the Nigerian woman, they are first-degree cousins. It's not a demon. Fibroid is nothing else other than an exaggerated response of your uterine muscles to estrogen. That's what it is. So if you go to a hospital and the doctor tells you have a fibroid, it doesn't mean that it's the end of the world. It only just means be careful with what you're now doing. A woman who sits down on a vanity chair to rub cream all over her body from head to toe, creams that are rich in estrogen, she's been told she has fibroids, that woman should stay clear from those creams. Because if you've had fibroid, and you see, you know the way you people women rub creams? You know how they do it? Do you know women rub creams on their back? Women even rub cream on their laps. For women here, I'm sure the last time creams touched our back was when our mother gave birth to us. Okay? But for women, it's not like that. They even rub cream to sleep. And they think that the cream stops on their skin. No. Those things you rub on your skin, they go through your skin into your bloodstream. And those ones, creams that are rich in estrogen, will promote fibroids. So I'm not surprised, therefore, to see that fibroids are increasing in our Nigerian women, because our Nigerian women are beginning to use a lot of creams designed to either make them fairer, some anti-aging things, some plastic things. Before you use any cream, just check what is the estrogen content. And the woman trusting God for the fruit of the womb, you have no business with that kind of a cream. Let me tell you how God designed it. A woman's estrogen is not supposed to be high at all times. No. God designed it that it should swing, and at times it should be low. It is the low estrogen level that triggers the brain to tell the brain, oh, this ovary needs to ovulate. When a woman sits down on a chair and adorns her body with all creams rich in estrogen, rich in progesterone, and rich in hydrocortisone and cortisol, what she is doing is that she's creating an elevated level of estrogen. That woman will not ovulate, because the body is treating her as though she's taking oral contraceptive pills. So you see why infertility is on the increase.
Well, don't white women use these creams as well?
Correct. The difference between the white woman and us is this. The white woman's uterus is not genetically predisposed to generating fibroids. If not, they would have been having it. Secondly, the white woman delivers 1 or 2 kids. The African woman delivers 5 and 6. So they also have the problem. So what they do, they have a lot of polycystic ovary too. They do. That is why infertility is also on the rise abroad. It's on the rise. That's why IVF centers will never cease to work. You can also appreciate, young ladies sitting here, that we're now beginning to have women who want to start procreation at the age of 40, 42. I want you to appreciate that. The dynamics, the quest for education, the passion for excellence at your place of work, your job description demands that some women need to put the issue of childbearing. You stay aside first, let me compete with this man. And now you want to start childbearing at the age of 42. No harm, because in this day and age, even if you are 50, you are 55, you are 60, the last patient I saw was 63 years old. And I'm so happy to see a 63-year-old woman opening the chapter of reproduction. And I'm telling her, don't worry, if you have the inner will to encourage, you can get pregnant. That's amazing. It's only God that could have been the author of such an awesome knowledge that has brought joy to many hearts and restored peace to many homes. So a woman at 42 who adorned herself with all the creams, now she wants to get pregnant, you get a ton of those creams. What's wrong with Vaseline? What's wrong with PS baby oil? What's wrong with it? A woman who is trusting God for the fruit of the womb will stay clear from many things. One of the things you're going to stay clear from are the kind of creams you use. Please, I urge our women in this who are listening to this Inside program, there are certain things you have to give up for some other things. I mean, how do you expect a man who is trusting God for the fruit of the womb to be putting on weight as if it is his job to put on weight? Do you forget that the more the weight of the man, the higher the heat around his testes and the lower his sperm count. So, what do you do to such a man? I want us to understand that God has given mankind so much knowledge, but knowledge confers responsibility, for God will not do for you what he expects you to do. There are things that God will do, but there are things you have to do. You cannot be drinking, you cannot be trusting God for the fruit of the womb. As a man, you take a bottle of Coke in the morning to eat, take one in the afternoon, and take one in the evening. You are pumping up your blood sugar, you are increasing your BMI. Instead of being 20, you are 35, and you want to conceive? No, 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 it doesn't work that way.
I'm sure you're having a great time listening to our guests. We're going for a short break. We'll come back. The doctor will continue from where he stopped.
Level Plus app is bigger and better. Watch all our shows with just a click.
Let him have the right to decide what happens with your body.
Watch inspiring, informative, and entertaining programs. You can comment, like, and share. Watch our live TV and web TV on your mobile devices. Watch the big stories in real time or when you have the time. Experience Lovewell Plus app right now. Download Lovewell Plus app on Android, iOS, and BlackBerry. Go to Google Play Store, Apple App Store, or Windows Phone Store. Welcome to the bigger picture. Lovewell Plus, beyond television.
Welcome back. This is Insight. We're still discussing fertility and childbearing. Now moving into, the solution to infertility among couples. I think we've even started dealing with, infertility. So right into the solutions.
The Bible says, I think in Proverbs chapter 11 verse 7 or verse 9, it says, by knowledge shall the just be delivered. Proverbs 4:7 says, in all your gettings get understanding. My alma mater said knowledge is power. If you want to change what people are doing, change what they know. Because the difference between individuals is all about information. Now, God does not speak vain words. When God says no woman is barren, he means no woman is barren. God is not a man that he should lie. So, over time, God gave mankind knowledge to begin to understand the process of human reproduction more. In time past, when we know that the commonest reason why women don't get pregnant was blocked fallopian tube, surgeries were done to open up the tubes. But it was discovered that if you do 100 of such surgeries in the best of centers anywhere in this world, maybe 5 of them will succeed. And out of those 5 that succeeded, 1 or 2 will end up with ectopic pregnancy. So it dawned on science that no, tubal surgery is not the solution to block tubes. Then came the issue of how do we overcome women who have problems in the cervix because the antigen antibody. And then people started prescribing the use of Dowchin, Savlon to clean the vagina. That's how those things came up. And then for the men whose sperm count is low, many drugs just flooded the market. And the problem became trying to treat erectile dysfunction. What I mean that men who don't have good erection, mixing it with men who have low sperm count. Many drugs now flooded the market. Unfortunately, and I want you to listen to me, those of you who are watching inside. I literally can say that those medications that are used to increase sperm count, what they do, they cause an initial increase, but there is a rebound effect. It drops it thereafter. The treatment, science says, the treatment for male infertility is assisted conception. That's the treatment.
Assisted
conception. What is assisted conception? Assisted conception is a process whereby the egg and the sperms are brought in close proximity to enhance the chances of fertilization. I mean, a man who is lame, and you really want to get a man to a crusade ground, I think the best thing to do is get a vehicle and take the man there. Now, for a sperm cell to move from the vagina to this point, as short as this, the length of the fallopian tube is only 10 centimeters. The length of the uterus from here to here is 8 centimeters. So this total journey is 18 centimeters. The length of the whole vagina is 10 centimeters. Therefore, from here, the entrance of the vagina to here, have about 28 centimeters. If you drop, even if a man drops sperm at the edge of the vagina, you know some women get pregnant when sperm is dropped on their laps. Yes. There are some women who are that fertile. Tells you the journey, that kind of a sperm, it's not only supersonic, but it was designed and correctly prepared to do exploits. Now, let's assume it did that journey, but even at that, that's quite a journey for the sperm. So, assisted conception says, bring the sperms and the eggs together. For women, most fallopian tubes are normal. But the problem is that the man cannot achieve erection. Therefore, he cannot deposit semen into the vagina. You know that can happen. Or the man has a premature ejaculation. Before the woman is even ready, he has poured the sperm on the semen on the bed. You got to help that man. That man must still have a child. Or the woman that this neck of the womb has some antibodies against sperms, such a way that each time the man deposits sperms here, the woman's body sees the sperms as microorganisms. It attacks it and kills them. That kind of a woman, I need to be able to overcome this barrier by taking the semen, process it, and dropping it inside the womb and allow it to do a journey. If you take semen as being produced, I want those of you listening on this Insight program to please get it clear that if you take semen as naturally produced by a man, if you put it in a syringe, because you've listened to me, and then you drop it inside the woman's womb, that woman is going to die right in your room. Because God did not design that semen in its raw state should enter into the woman's body. No. Semen don't enter into women. It is sperm into the uterus. It is sperm cells that swim out of the semen. So when Adesuwa, if I give Adesuwa semen, Adesuwa is going to remove every other thing and leave me with sperm cells in a medium that I can now drop here. Adesuwa is going to tell us how you achieve that. That is one form of assisted conception. That is called intrauterine insemination. IUI. You want to talk more about intrauterine insemination?
Yeah.
Okay.
The intrauterine insemination is used for men that have a low sperm count, but not usually between anything from 2 million and 5 million and above to between 5 and 19 million. You would advocate an intrauterine insemination for the man, and his partner's fallopian tube must be patent. So what you do is, once he ejaculates the semen, he gives to you in a bottle. Then you take it through a form of centrifugation to remove the liquid out of the semen. Then at the bottom of the tube, you have the sperm cells concentrated. That's, of course, after checking the sperm count and everything. Now, those sperm cells are washed in a specific medium that helps to enrich the sperms. So you give them the food they need and all the energy they need to do the job. But in a the medium is more processed, and it can be accepted by the female body. So you suspend the sperm cells in a tiny portion of that medium, and you aspirate it, hand it over to the doctor in a syringe, and then he uses a tube to go through the vagina into the woman's, and stops at the cervix here. Then once you push in the sperm now containing the medium, you've crossed the barrier that you're looking at. So the sperms get into the uterus and then continue the journey. So you've taken off, say, about 12 centimeter or thereabout of the journey that they have to go through. So this makes the journey faster, and the sperms get there a lot quicker than having to go through the barrier naturally.
And before doing that, we have to make sure the woman is ovulating. And so we'll give the woman some medications to ensure she ovulates in the cycle under review, and we'll monitor to make sure ovulation occurs. We're going to give you medications to ensure that ovulation occurs. All right, that is intrauterine insemination. The other process is called the in-vitro fertilization embryo transfer. What is in vitro? In vitro fertilization means fertilization that took place outside the human body. In vivo fertilization is fertilization inside the human body. In other words, when an egg is released, this fallopian tube knows that this egg has been released. It picks it up from anywhere it is in your body. God is awesome. It knows. It just holds it there and holds the egg there for 12 to 24 hours, waiting for the sperm to come. So for women who are trusting God for the fruit of the womb, you don't have sex only during your ovulation. please, you have sex every 2 days. Sex for you is a job. It's a full-time ministerial assignment until mission is accomplished. To have sex 196 times in a day, that's not the kind of person that should be fasting for 70 days in a year. Because if you fast for 70 days, how many days is left for you to have sex? It's not the time for the man. You think when in the nation of Israel, when a man marries, God made a provision that he should go and stay with his wife for 1 year. Because God knows that no woman is considered to be infertile until 1 year of regular unprotected sexual exposure. You can't marry a woman in January and take off to Geneva in February and come and meet her in June on the day she thinks she's ovulating. How do you know you are ovulating? Oh, because you have pain? Or because your breast is tender, or because you saw a spot of blood, or because your body temperature is warm, or because you did a spin bucket sign where you took the cervical mucus. Those things are only speculative. The only time you will know that a woman has released an egg is we that will tell you when it has happened. We will tell you that you ovulated. At that time, it's past. So the only way out, distinguished audience, is have sex regularly 3 to 4 times every week, and may the Lord give you the strength. Now let's come back. So let's come back to this business. In vitro fertilization, what we do, we will identify that this woman can produce eggs. We will give you medications. Now, I told you that at the beginning of every month, nature makes a provision that a woman should recruit about 30 eggs from the storehouse. You remember I told you that? But only one gets to maturity. Now, God has given mankind knowledge. We now know how to keep those other 29 that should have died. We know how to keep them alive. So that a woman starts 29 eggs at the beginning of the month, 30 eggs. I can, even if I cannot get 30, I can get 20. I can get 25 by the use of medications. Now, when it is time for you to ovulate, I know because I have taken over your human body. I gave you medications to make sure you don't ovulate. I gave you medications to make sure the eggs develop. I'm using ultrasound scan to monitor the eggs to make sure they are developing well. And then, when it is time, I know the exact minute ovulation is going to take place. I take you back to the theater, use a very tiny needle, go through your body system, and pick these eggs out. Just pick all of them out. When I finish picking them, I give them to Idahosa. Idahosa, please do something about these eggs. Idahosa, tell me what you do about the eggs, and we'll take it off from there.
once fertilization takes place here, those finger-like effects start a wave, a reverse motion, pushing the embryos backwards. So you notice that it takes a period of 5 days from fertilization for it to get back into the uterus and start implantation. So through the tube, it moves it backwards, day 1, day 2, day 3, you know, it just keeps moving. So by the time you get to day 5, the embryo is back into the uterus, it sticks into one of these crevices here, and then it starts to grow into a baby.
When IVF started about 39 years ago, the inventors could only keep babies for 24 hours. Now we can keep babies for 6 days. I tell you, a time is coming in this world. A husband, a wife will marry. When we do in vitro fertilization, they are coming back from work. They will brush to see how the babies are doing. True. A day is going to come in this world, we're not going to require a woman's womb for pregnancy.